composite specimen of rectum and anal canal. Now, how to hold in anatomical position? The two hands should be placed like the curvature of the sacrum, that is anteriorly concave, and the rectum is placed in the sacral curvature. The ampulla part is present at the coccyx level, like the tip of our fingers is like the tip of coccyx. So this is the ampulla, which is the dilated portion, and after the ampulla this is the portion of anal canal, which is faces posteriorly. So this is rectum, ampulla and anal canal. Okay. The anterior and posterior part. The posterior part of the rectum will be given in cut section. So this is the posterior part, which will be placed on the palm, and this is the anterior part. Now the inner surface, the inner surface of the rectum, there will be many folds of muscle, that is the rugae, but in the anal canal, this is the anal canal, you can see longitudinal columns. These are the column of Morgagni, anal columns of Morgagni. These are the anal columns of Morgagni. Now superior to the column is the presence of anal valve. This is one valve, this is another valve. So anal column of Morgagni and anal valve. Now the apex of the valve projects upward, forming the papilla, anal papilla. And at the junction of anal valve and the longitudinal column, there is one space. This is the anal sinus, and this anal sinus contains the anal glands. So these are the longitudinal columns, anal column of Morgagni. These are anal valves. These are valves. These are the anal papilla, the apex of the valves facing superiorly, and the junction of valve and the column. These are the anal sinus containing anal glands. Now, at the level of anal valves, if we draw a long circular line, this line is the pectinate line or pectineal line.